If you're watching this video, either you or someone you care about is suffering from low back pain. In regards to low back pain, I see three things typically that cause it. Once in a while I'll get lucky and when somebody comes in, they actually have a story to go with why they have low back pain. But typically that's not what I see. So in regards to that, there will be an issue in their hip capsule. So if you don't move through this ball and socket joint very well, just to move, you're now going to have to use your back, which will cause pain in these little facet joints. Or these external rotator muscles, these muscles that are all out here on the side of your hip. When you move this way, they get really, really tight, and again, they restrict how much you can move through the ball and socket joint, thus causing you to have to move more through your back just to move around. And then lastly, the big one is if you've injured a disc in your lower back. So let's take a moment and let's kind of dissect through those things and figure out which one you may have. So now let's look at some of the anatomy more in detail in regards to the structures that will give you low back pain. So if I start taking out your abdominal muscles here, we're going to be able to see your hip flexors, which I know hip flexors is a word that gets used all the time in describing why you have low back pain. But normally when I ask people, they don't actually know what those are. So my bicep muscle is an elbow flexor. I know, no laughing at lack of size, but your hip flexor muscles are a hip flexor. So that's kind of how those go together there. So those are the three muscles that make up your hip flexors. When I turn this guy sideways, you can see how deep they are. So I don't have any of your guts or small intestine stuff in here. So they are very, very deep. And as you can see, they attach to your spine. Like they actually attach to your spine. Like when I touch here on my back, I'm actually closer to my hip flexors than when I touch here on my stomach. So let's say on someone my size, we'll just estimate that my hip flexor should be about 18 inches in length. If I sit all day long, now I only need like 12 to 14 inches. So over time, what you're gonna do is you're gonna shorten and shorten and shorten that group of muscles. Well, it attaches here to your leg and to your spine. So if that was the case, if I needed 18 inches and now I'm at 12 inches, that means I should walk around like this. However, I won't, because what I'll do is I'll extend my back a whole bunch to stand up straight to walk around. But what you're doing in return is you are pinching the little facet joints really badly. So these little joints clear down here in your back where one spine bone connects to the next one. There's supposed to be a little bit of a space where they connect there. And as you extend this thing backwards, you'll just pinch it really hard and get dull, achy, non-specific low back pain. So that is by far the most common cause that we see with people who walk in and say, I have no idea why my low back hurts. It's just kind of getting worse and worse and I don't know how to make it any better. And the really, really neat thing is the way we practice here at Spine and Sports is we focus primarily all on muscles. Like you'll have a 30-minute session and the whole time what we're gonna do is we're gonna grip and rip on those muscles and make them longer so that way we can take the pressure off the joints. So that's one of the most common reasons why people get low back pain. I mentioned those other ones with like discs and hip capsule stuff. So it's super important when trying to diagnose why you have low back pain to be able to go through those different mechanisms and then get the appropriate treatment. So if you or somebody you know has low back pain, Spine and Sports Chiropractic is a great place to start. We're only one phone call away.